What are piles after the age of 50? And why do so many sensible, careful people end up suffering quietly with this problem years without talking about it? If you are over 50 and you have ever noticed bleeding during bowel movements, pain while sitting, itching, burning, or a heavy, uncomfortable pressure in the rectal area, please do not ignore it. And please do not tell yourself this is just part of aging, because very often it is not, it is piles. And when piles are ignored, they rarely stay mild. They slowly worsen and begin to affect comfort, confidence, daily routine, and overall quality of life. Before we go any further, let me say this clearly and honestly, the same way I would say it in my clinic. Everything I am sharing today is based on medical research and doctor recommended guidelines. I always encourage you to verify information yourself, and I will mention trusted medical sources in the video description. Now, let me talk to you calmly, naturally, and honestly. After the age of 50, the body starts changing in ways that are quiet but powerful. Digestion becomes slower. Muscles are not as strong as before. Healing takes longer. Bathroom habits change. Many people don't even notice these shifts at first. But right in the middle of all these changes, piles often begin to form slowly, silently, often without much pain in the beginning, and that is exactly why so many people miss the early signs. Piles, which doctors also call hemorrhoids, are swollen and inflamed veins in the lower rectum or around the anus. These veins are actually normal structures. They help with bowel control, and they are meant to stretch slightly during bowel movements. The problem begins when pressure keeps repeating over time. Day after day, year after year, the veins lose their strength. They stop bouncing back, they swell, they become irritated, and eventually they start causing symptoms. After the age of 50, this process speeds up not because you failed to take care of yourself, not because you did something wrong, but because aging itself changes how the body handles pressure, blood flow, and tissue repair. One of the biggest reasons piles become common after 50 is weakening of support tissues. The connective tissues that hold rectal veins in place naturally lose elasticity with age. And so even pressure that once felt normal can now cause veins to bulge more than they should. The veins become more vulnerable and piles begin to form. Another extremely important factor is constipation. Constipation is incredibly common after the age of 50. Digestion slows down, physical movement often decreases, fiber intake becomes irregular, water intake drops even more. On top of that, many medications commonly used after 50, such as blood pressure medicines, diabetes medications, painkillers, iron supplements, and antidepressants, can harden stools. When stools become hard and dry, people strain, and straining is the single biggest enemy of rectal veins. Every time you strain, you force blood aggressively into veins that are already weak. Over time, the vein walls stretch permanently. This repeated pressure is one of the main ways piles develop. Now, let's talk about something people rarely connect to piles: sitting. Long hours of sitting, whether at work, at home, or even on the toilet, reduce blood circulation in the rectal area. Blood begins to pool in the veins. Pressure builds, and if you sit on the toilet for long periods, especially while using your phone, that pressure stays there far longer than it should. This habit alone has caused piles in countless adults. Diet also plays a massive role. After 50, many people unintentionally eat less fiber. Meals become softer, more refined, and more processed. White bread, white rice, packaged foods, and low fiber snacks slowly replace fruits, vegetables, and whole grains. Fiber is what keeps stools soft and bulky. Without enough fiber, stools become dry, hard, and difficult to pass. Hydration is another silent but powerful factor. As people age, the sense of thirst becomes weaker. Many adults simply do not feel thirsty even when their body desperately needs water. Dehydration leads to harder stools, slower bowel movements, and more straining. For women, there is another factor that often appears later in life: pregnancy history. Even if pregnancies happened decades ago, the strain they placed on pelvic and rectal veins increases lifetime risk of piles. After menopause, when hormone levels drop and tissues weaken further, that risk can resurface. Weight gain, especially around the abdomen, also matters. Extra abdominal weight increases pressure on pelvic veins. This makes it harder for blood to flow upward, causing blood to pool in rectal veins and increasing the likelihood of hemorrhoids. Now let's talk about symptoms, because this is where most people delay seeking help. In the early stages, piles may cause very little pain or no pain at all. You might notice a few drops of bright red blood on toilet paper. You might feel mild itching, irritation, or slight discomfort. You may feel like your bowel didn't completely empty because these symptoms are mild. People ignore them. Over time, symptoms begin to change. Sitting becomes uncomfortable. Pain may appear during or after bowel movements. Swelling may develop around the anus. Burning sensations may follow bowel movements. Some people notice mucus discharge, others feel constant pressure or heaviness in the rectal area. Then there are symptoms that should never be ignored after the age of 50: persistent bleeding, sudden severe pain, rapid swelling, dark or black stools. Any of these signs require medical evaluation. Not all rectal bleeding is piles, and after 50, doctors must always rule out serious conditions such as colorectal cancer. Please remember this clearly and firmly. Never assume bleeding is just hemorrhoids after the age of 50. Another reason piles worsen over time is neglect. Each episode of straining stretches the vein walls further. Ignoring early symptoms allows inflammation to deepen. Poor bathroom habits, forcing bowel movements, delaying the urge to go, or sitting too long continue to damage the area. Gradually, piles begin to affect daily life. Sitting becomes uncomfortable. Sleep may be disturbed by itching or pain. Anxiety develops around bowel movements. Some people begin avoiding social situations. Many quietly adjust their lives around this problem without ever asking for help. But the truth is simple and reassuring. Piles are one of the most common conditions doctors see, and in most cases, they are very treatable. Prevention and control start with daily habits. Fiber must become a regular part of your routine. Vegetables, fruits with skin, oats, whole grains, beans, and lentils all help soften stools and reduce pressure if diet alone is not enough. Fiber supplements like psyllium can help, but fiber should always be increased gradually to avoid gas and bloating. Water is not optional. Most adults over 50 need at least 6 to 8 glasses of water daily, sometimes more in hot climates or with physical activity. Water keeps stools soft and easier to pass. Bathroom habits matter deeply. Never strain, never sit longer than a few minutes, and never ignore the urge to go. Delaying bowel movements allows stools to dry out and harden. Movement is medicine. Even light daily walking improves bowel regularity, circulation, and digestion. You do not need intense exercise. Consistency is far more important. Maintaining a healthy weight reduces pressure on pelvic veins. Even modest weight loss can significantly improve symptoms. Warm sitz baths can bring real relief. Sitting in warm water for 10 to 15 minutes relaxes muscles, improves blood flow, and reduces pain and itching. Now let's talk about treatment, because lifestyle changes alone are sometimes not enough. In mild cases, topical creams, anti-inflammatory ointments, and short-term stool softeners help control symptoms. If piles persist, doctors may suggest office-based procedures such as rubber band ligation, sclerotherapy, or infrared treatment. These procedures are usually quick, minimally invasive, and highly effective. In more severe cases, when piles are large, painful, or bleeding heavily, surgical options may be considered. Procedures such as hemorrhoidectomy or stapled hemorrhoidopexy are reserved for advanced cases, are done after careful evaluation. Treatment is always individualized. Your age, symptoms, overall health, and lifestyle all matter. Now, let me clearly explain when you must see a doctor without delay: if bleeding lasts more than 1 week, if pain becomes severe, if there is fever, if stools turn black, or if bowel habits suddenly change. These signs should never be ignored. Let me reassure you calmly and honestly, piles after the age of 50 are common, but long-term suffering is not necessary. With early attention, correct habits, and medical care when needed, most people experience significant relief and return to comfortable daily life. If this video helped you understand your body better, please like, subscribe, and share it with someone who may need this information. Open conversations about health save lives. Your comfort, dignity, and health matter at every age.